Beginning with our tray, you're going to see our basic instruments, hand pieces, disclosing polishers, floss, everything that you need for this procedure. Beginning with our hand piece, there's a specific way of how we put these together. Begin by going and sliding the straight angle onto the slow speed motor. Looking at the bottom of the motor, you're going to see some ports where you're going to hook this up to the handpiece hose. Make sure you align it correctly. Push the collar up to the motor and secure by tightening, turning to the right. Now with the portion to put our slow speed to work as a polisher. First we're going to go and see the notch at the top of our slow speed, attach our Profi cup by sliding it onto the notched portion, making sure it is fully down. Pinch above the blue ring, below the blue ring, and then turn to lock into place. Be sure that it is locked completely and you test your handpiece. Always be sure to turn off your water to slow speeds. As mentioned before, if you go and slide that down and it does not match up completely, don't force it. Unlock your handpiece and slide down till it matches. And test to make sure the head just spins, not the complete body. If it is unlocked and unsecured, the whole body will spin. We do not want that because we are not trying to make a shortcut and polish all the top and bottom teeth at the same time. Choose our Profi paste and flavor, usually found at the top, also with our coarseness. All the flavors that we have taste like they've been poisoned or are stale medicine flavors. Probably the normal tasting ones is grape, mint, and banana. Your Profi paste will be firm at the beginning. I highly recommend to stir it up, just running your Profi angle and just dipping it in there until it loosens up. You can easily grab it with a swipe of your cup. Depending on the person's age, their mouth may fill up more slowly or quick. Choose the appropriate suction for those appointments, such as a saliva ejector may remove some material from their mouth, but in harder cases, we want to use the HVE or our high vac to go and remove a lot amount of water at a time. Starting at the corners of the mouth, go one portion to the other. Be sure to keep away from the tissues such as cheeks, lips, tongues, or even the uvula. The patient will remember it for next time if you do. Disclosing tablets are a great education tool for your patients. Have them chew on the tablet and swish around their mouth. This will educate your patient on how to properly brush and show the places since their last brushing where their plaque remains. Give them a mouth mirror, show them and explain proper oral hygiene instructions. When grabbing your polisher, make sure to hold it in a pen-like grasp as if you were to write something, using your ring finger or pinky finger to fulcrum or support yourself. As you begin, it's going to feel like you're going to need extra hands because your hands are holding so many different things, retracting, reflecting, polishing, suctioning, trying to grab at other things that you may need. Who knows? When beginning, be sure to use your fulcruming fingers to find a nice anchor spot, such as tooth structure, when you begin your sequence. In certain techniques, starting from the gingiva and sweeping down the tooth in a couple of patterns such as 3 sweeps, mesial, middle, distal, is a good way to begin. Be sure to sweep all the way from top to bottom. Other people may want to use more of a wax on, wax off technique, hitting every tooth in small circular motions. Be sure to go to the gingival crest of the tooth to remove any plaque that got hidden while doing these motions. Make sure to hit the incisal edges of your teeth, canines, laterals, and centrals, and also the lingual sides using your mirror to reflect. Also in the posterior, make sure that you're going after the individual cusp tips. Your edges of your Profi cup will go into the grooves. Some of the more difficult spots to polish and for patients to clean is the posterior teeth on the cheek side, on the buccal portion. Have your patient slowly close as the instrument's in their mouth to allow for enough room to polish and for the toothbrush to reach back there to clean the plaque off adequately. Another tend to be missed spot is going to be tongue side, right between the tongue and the tooth, around the lingual portion at the gingival crest. Just push it off to the side and hit those areas with the polisher or their toothbrush. Instruct your patient how to do so also. One of the more common things that cause patients discomfort and sensitivity is when someone sits on the tooth burning away at it because they're trying to remove a difficult stain. Swipe it and move on. Now moving on to the next portion, which more than half of the population doesn't do, and that's floss. But more importantly, floss correctly. When flossing, it should hug around the tooth in a C-shaped motion, going underneath the gingiva a little bit, be able to get into the sulcus. But watch out, there tends to be food there. Do watch out for flying food particles when flossing. Make sure that your mask is all the way up, goggles down, and if needed, wear a face shield to protect your whole face. Get protection on your face, don't end up looking like a clown going all over the place. Also be sure to protect your patient with their own goggles too. Be sure to check back with the channel for any new dental videos, tutorials, or any requests in the comments.